51. Ciprofloxacin can cause tendon rupture as a rare side effect. True or false? Answer: true. Rationale: fluoroquinolones like ciprofloxacin are associated with increased risk of tendinitis and tendon rupture, especially in older adults. 52. Chlorpromazine is an antidepressant medication. True or false? Answer: false. Rationale: chlorpromazine is a typical antipsychotic used to treat schizophrenia and severe behavioral disorders, not depression. 53. Diltiazem is both an antihypertensive and an antiarrhythmic. True or false? Answer: true. Rationale: diltiazem is a calcium channel blocker used for hypertension and atrial arrhythmias, such as atrial fibrillation. 54. Levodopa is converted into dopamine in the brain to treat Parkinson's disease. True or false? Answer: true. Rationale: levodopa crosses the blood-brain barrier and is converted into dopamine, improving motor symptoms in Parkinson's patients. 55. Antihistamines block histamine receptors to reduce allergic symptoms. True or false? Answer: true. Rationale: antihistamines block H1 receptors, decreasing allergy symptoms like sneezing, itching, and swelling. 56. Bupropion increases the risk of seizures, especially at high doses. True or false? Answer: true. Rationale: bupropion lowers the seizure threshold, particularly in patients with eating disorders or when taken at high doses. 57. Hydralazine causes vasoconstriction to raise blood pressure. True or false? Answer: false. Rationale: hydralazine is a vasodilator that relaxes arteriolar smooth muscle, lowering blood pressure. 58. Antacids can interfere with the absorption of many medications. True or false? Answer: true. Rationale: antacids can alter gastric pH and bind to certain drugs, affecting their bioavailability and effectiveness. 59. Sucralfate should be administered after meals for best effect. True or false? Answer: false. Rationale: sucralfate forms a protective barrier over ulcers and is most effective when taken on an empty stomach before meals. 60. Phenobarbital is a barbiturate used to treat seizures. True or false? Answer: true. Rationale: phenobarbital enhances GABA activity in the CNS and is used as a long-acting anticonvulsant, especially in pediatric patients. 61. Furosemide is a potassium-sparing diuretic. True or false? Answer: false. Rationale: furosemide is a loop diuretic that causes potassium loss, increasing the risk of hypokalemia. 62. Tetracycline should not be given with dairy products. True or false? Answer: true. Rationale: calcium in dairy binds with tetracycline, reducing its absorption and therapeutic effect. 63. Warfarin therapy requires monitoring of the INR level. True or false? Answer: true. Rationale: INR is used to monitor warfarin's anticoagulant effect and prevent bleeding or clotting complications. 64. Aspirin should be avoided in children due to the risk of Reye's syndrome. True or false? Answer: true. Rationale: aspirin use in children, especially during viral illnesses, can lead to Reye's syndrome, a serious condition affecting the liver and brain. 65. Flumazenil is used to reverse opioid overdose. True or false? Answer: false. Rationale: flumazenil reverses benzodiazepines. Naloxone is the antidote for opioid overdose. 66. Insulin glargine is a long-acting insulin with no peak. True or false? Answer: true. Rationale: insulin glargine provides steady, long-term blood glucose control with minimal peak effect, reducing hypoglycemia risk. 67. Epinephrine is used to treat anaphylaxis. True or false? Answer: true. Rationale: epinephrine causes bronchodilation and vasoconstriction, reversing life-threatening symptoms of anaphylaxis. 68. Anticholinergic drugs increase salivation and GI motility. True or false? Answer: false. Rationale: anticholinergics reduce secretions and slow GI motility by blocking parasympathetic activity. 69. Ondansetron is an antiemetic that blocks serotonin receptors. True or false? Answer: true. Rationale: ondansetron blocks 5-HT3 serotonin receptors in the brain and GI tract, preventing nausea and vomiting. 70. Nitroglycerin should be stored in a dark glass container. True or false? Answer: true. Rationale: nitroglycerin is light and heat-sensitive and should be kept in its original container to maintain potency. 71. Metoclopramide is used to treat constipation. True or false? Answer: false. Rationale: metoclopramide increases GI motility but is mainly used for nausea, GERD, and gastroparesis, not constipation. 72. Beta blockers can mask the symptoms of hypoglycemia. True or false? Answer: true. Rationale: beta blockers can blunt sympathetic responses like tachycardia, making hypoglycemia harder to detect. 73. Vancomycin requires peak and trough levels to be monitored. True or false? Answer: true. Rationale: monitoring peak and trough levels ensures therapeutic effect and reduces nephrotoxicity or ototoxicity risks. 74. Isotretinoin is safe to use during pregnancy. True or false? Answer: false. Rationale: isotretinoin is highly teratogenic and contraindicated during pregnancy due to severe fetal defects. 75. Digoxin increases the heart rate and cardiac output. True or false? Answer: false. Rationale: digoxin slows the heart rate while increasing myocardial contractility, improving cardiac output. 76. Lorazepam is a short-acting benzodiazepine used for anxiety. True or false? Answer: true. Rationale: lorazepam is commonly used for anxiety, sedation, and seizures due to its rapid onset and effectiveness. 77. Levothyroxine should be taken at bedtime with food. True or false? Answer: false. Rationale: levothyroxine is best absorbed on an empty stomach in the morning to ensure consistent absorption. 78. Propranolol is a selective beta-1 blocker. True or false? Answer: false. Rationale: propranolol is non-selective, blocking both beta-1 and beta-2 receptors, affecting heart and lungs. 79. Acetylcysteine can be used to loosen thick mucus in cystic fibrosis. True or false? Answer: true. Rationale: acetylcysteine is a mucolytic that breaks disulfide bonds in mucus, making it easier to clear. 80. Phenytoin can cause gingival hyperplasia. True or false? Answer: true. Rationale: gingival overgrowth is a known side effect of phenytoin, especially with poor oral hygiene. 81. Spironolactone causes potassium loss. True or false? Answer: false. Rationale: spironolactone is a potassium-sparing diuretic and can lead to hyperkalemia. 82. Lactulose is used to treat hepatic encephalopathy. True or false? Answer: true. Rationale: lactulose reduces ammonia levels by trapping it in the colon and promoting its excretion. 83. Carbamazepine can cause agranulocytosis. True or false? Answer: true. Rationale: carbamazepine carries a risk of severe blood dyscrasias like agranulocytosis, requiring regular CBC monitoring. 84. All antihypertensive medications can be stopped abruptly. True or false? Answer: false. Rationale: abrupt discontinuation can cause rebound hypertension or other complications, and tapering is recommended. 85. Acetaminophen has anti-inflammatory effects. True or false? Answer: false. Rationale: acetaminophen provides analgesic and antipyretic effects, but lacks significant anti-inflammatory properties. 86. Heparin is safe to administer intramuscularly. True or false? Answer: false. Rationale: heparin is given subcutaneously or intravenously. IM administration increases risk of hematoma. 87. Clopidogrel is an antiplatelet medication. True or false? Answer: true. Rationale: clopidogrel inhibits ADP-induced platelet aggregation to prevent thrombotic events. 88. MAO inhibitors interact safely with tyramine-rich foods. True or false? Answer: false. Rationale: tyramine-rich foods can trigger hypertensive crisis when taken with MAO inhibitors due to increased norepinephrine. 89. The therapeutic range for theophylline is narrow. True or false? Answer: true. Rationale: theophylline has a narrow therapeutic index, requiring monitoring to prevent toxicity, especially cardiac and CNS effects. 90. Erythromycin is known to cause QT interval prolongation. True or false? Answer: true. Rationale: erythromycin may prolong the QT interval, increasing the risk for life-threatening arrhythmias like torsades de pointes. 91. Naloxone can be administered intranasally. True or false? Answer: true. Rationale: naloxone can be given intranasally to reverse opioid overdose, offering rapid absorption and ease of use in emergencies. 92. Morphine is contraindicated in patients with head injuries. True or false? Answer: true. Rationale: morphine can increase intracranial pressure, worsening the condition in patients with head trauma. 93. Methotrexate is classified as a disease-modifying antirheumatic drug, DMARD. True or false? Answer: true. Rationale: methotrexate is a DMARD used in autoimmune diseases like rheumatoid arthritis to slow disease progression. 94. Atenolol is a calcium channel blocker. True or false? Answer: false. Rationale: atenolol is a beta blocker, not a calcium channel blocker. It reduces heart rate and blood pressure. 95. Ciprofloxacin should not be taken with antacids. True or false? Answer: true. Rationale: antacids containing aluminum or magnesium can interfere with ciprofloxacin absorption, reducing efficacy. 96. Lithium levels must be monitored to prevent toxicity. True or false? Answer: true. Rationale: lithium has a narrow therapeutic range, and toxicity can lead to tremors, confusion, seizures, or renal damage. 97. Clindamycin is associated with a risk of Clostridioides difficile infection. True or false? Answer: true. Rationale: clindamycin use can disrupt gut flora and increase the risk of C. difficile overgrowth and colitis. 98. Ibuprofen can be safely used during all trimesters of pregnancy. True or false? Answer: false. Rationale: ibuprofen should be avoided in the third trimester due to the risk of premature closure of the ductus arteriosus. 99. Albuterol is a short-acting beta agonist used for acute asthma relief. True or false? Answer: true. Rationale: albuterol causes rapid bronchodilation, relieving bronchospasm in acute asthma attacks. 100. Simvastatin should be taken in the morning. True or false? Answer: false. Rationale: statins like simvastatin are typically taken at night when cholesterol synthesis is highest.